Hey, everybody, and welcome to Keeping It Spiritually Simple. My name is Sandra, your host, and today I have an awesome guest by the name of Margarida Jorge, and she is the Director of Healthcare of America, Executive Director, actually. She's going to tell us a little bit about how to lower drug prices or why drug prices are so crazy and why most of us feel it's a mystery and we're in the dark, and what someone like she is doing on our behalf, and then possibly how we can step up and help as well. So welcome, Margarita.
Thank you. Thanks for having me.
Oh,
Well,
sure.
I'm excited to talk about this topic because the high price of prescription drugs really, anybody who's been to CVS lately to pick up a prescription, you may be wondering what the heck is going on, because just a year ago, this medicine cost $300 less or it cost $200 more. There seems like there's no rhyme or reason to the price for prescription medicines in America. And that is because there's no rhyme or reason to the pricing for prescription drugs in America. So in most countries around the world, prescription drug prices are determined through a process of negotiation. So that is, the state, the nation, will negotiate with drug corporations to get a bulk rate, right? So they'll negotiate for things like insulin or asthma inhalers, cancer medicines. And through that process of negotiation, they will come to a reasonable price, and that will be the price. That's the price that's set, and the drug companies can't then change the price when they want to. Now, the United States is really unique because we do not have negotiated prices for prescription drugs. So that is, in this country, prescription drug companies have a lot more power to set their own prices than almost any place else. And that is why Americans pay 2 to 3 times more for brand name drugs than people pay for those same drugs in other countries. And if you've been abroad and you got sniffles or you got a sick or whatever, and you went to buy medicine, or you bought insulin in a different country, you might be struck by how much cheaper it is in other places than it is here. And of course, there's caravans of people in the United States that cross the border on both sides, Canada and Mexico, pretty frequently to get more affordable medicines. There's a couple of reasons why drug companies have so much power in the United States. So one is we have a patent system that is a really pretty problematic patent system. So most medicines, most prescription drugs are developed through a combination of taxpayer-funded research through the National Institutes for Health, and then some investment that drug companies make. But the vast majority of the investment goes to research universities through the National Institutes of Health to develop what they call the molecules. Those are the magic ingredients, right? The building blocks that really make a medicine effective. That research is handed over to drug companies, who then do the last couple of stages of development. They will take the drug through clinical trials. They'll figure out how to market it. And then once they do that, they get a patent that's an exclusive patent. So what that means is they are the only company that can manufacture that medicine, and they have no competitors. And often a drug company will get a 20-year patent for a drug. So for 20 years, they have exclusive rights to that drug, and nobody can create a generic. Nobody can tell them what to charge for it. They set the price, and the price is usually what the market can bear. And there's lots of gamesmanship in the patent system. So one thing that drug companies have gotten very good at is a process called evergreening, where they've got that 20-year patent, and then when that patent starts to get toward its expiration date, drug companies often will make a tweak in the drug, and that'll help them to extend the patent for a period of years. So drugs that have sold and made companies gazillions of dollars, the drug Oxycontin, for instance, right, which was a really, became very famous because of the opioid crisis. That drug had a 30-year patent, no competitor. So not only was it a very addicted drug, and was it a drug that was very widely prescribed, but also there was no way to bring down the price of that drug because the drug company Purdue had exclusive rights to that patent. And that's pretty typical of what happens in the United States. So the system does not facilitate the type of competition that you would need to bring down prices. And that has really created a crisis in the system where a lot of people can't afford basic medicines. Right now, 4 in 10 people can't afford the price of their prescriptions. So anyway, this has been an ongoing problem. One thing that made it worse was in 2003 when Medicare created Part D. Part D is the prescription drug part of the Medicare plan. Medicare insures the nation's seniors and people with disabilities. Medicare is the largest purchaser of prescription drugs. And about half of the money in Medicare goes to pay for a pretty small number of drugs, probably 25 drugs. They're the 25 most expensive drugs, and they're drugs that are drugs like Xarelto, Eliquis, blood thinners, lots of insulin products. So a lot of medicines that treat sicknesses that you would expect older people to have. As people age, they have more need of prescription drugs. Most people in Medicare have at least one prescription. Sorry, I've got allergies. I need a
okay.
prescription for my
That's
allergies.
okay.
Medicare in 2003, when the Medicare Part D program was created, advocates like myself that have been working on prescription drugs for a long time really thought, okay, this is an opportunity. We should write into the law negotiated prices, right? Because this is the largest purchaser, and Medicare would have a lot of power and a lot of leverage to negotiate for prices with drug companies. But because the drug lobby is so powerful, they were able to intervene, and we ended up with a law that not only did not have negotiations, that law expressly prohibits negotiations. So Medicare negotiations was prohibited for years. And then we saw the price of Medicare skyrocketing. Now, here's why people should care about that, whether or not they're in Medicare. Medicare is it's a taxpayer-funded program. It's a public program. So that means that if you look at your paycheck, remember, for people that remember the old days when you get a paper paycheck, you would see that there's taxes that you deduct. People who are working age people deduct taxes into Medicare. That's to fund the healthcare system for their retirement. Just the way you deduct taxes for Social Security, you deduct taxes for Medicare. And the higher your income is, the more taxes you deduct to Medicare. So we're all paying for the high price of prescription drugs in Medicare, whether or not we are paying at the pharmacy because we're a Medicare enrollee and we're actually going to go get a prescription, or whether we're a taxpayer and we're paying on the front end for that program to be there later on when we retire, because we're going to need that benefit. So we've been working on this for quite a long time. I'm going to tell you guys that the prescription drug lobby, pharmaceutical lobby, they have a lobby group called PhRMA. And it is the most powerful lobby in Washington, D.C. It's massive. You know, there's 400 members of Congress, roughly 420 members of Congress at any given time. And that's just in the House. And PhRMA has 2.5 lobbyists for every single member of Congress. And when it comes to the political parties, I'll just tell you that Democrats and Republicans have been both very problematic on prescription drugs, because they've both been lobbied very aggressively by the prescription drug lobby, and the prescription drug corporations have gotten really affected at making campaign contributions to really sway lawmakers of both parties away from making the reforms that have been needed. But we finally made some progress on this in 2022, and I have to really give President Biden a lot of the credit. He really pushed to have prescription drug reform be part of his agenda. And so what we accomplished in 2022 under a law called the Inflation Reduction Act was pretty significant. It took us 20 years to get there, but it really represents the first time that we've seen Congress take on pharma in a big way. There's two kinds of reforms in that law. There's cost reforms and there's price reforms. And it might seem like those are the same thing. They're really not. Price is what drug companies can charge us. Cost is what we actually end up paying. Both are problems, but price is often a bigger problem. And that problem is tied to the fact that, as I said before, drug companies in the US don't have to negotiate, so they can name their price. And they can name it, they can change it anytime they want to. Already in 2024, they have raised the price of 400 prescription drugs in January, and they don't really have to provide any justification for why they're raising those prices. So in the 2022 law, and this law is important because it's being implemented right now. It has a 6-year window for implementation. It does several important things. One is, for the first time, it reinstates negotiations in Medicare. So it's going to enable Medicare for the first time to negotiate prices on a limited number of drugs. The 10 most expensive drugs in Medicare. So the Xarelto, Eliquis, Januvia, a bunch of drugs that are very commonly prescribed and very widely used are for the first time going to have negotiated prices. HHS, the government agency that's in charge of negotiating prices, is right now back and forth with the 10 companies. And this 10 is just a start. The number will grow to 25 over the next few years. And there's a lot of people who are really calling for an expansion of the law, including the president himself, calling for an expansion of the law that we should negotiate prices on all medicines, which frankly would be fantastic. That'd be great. So that negotiations is the centerpiece of the law. The drug companies are very upset about it. They have already filed lawsuits, 9 lawsuits, and they're going to keep filing lawsuits to try to overturn the law. Second really important thing in the law that didn't exist before is the law caps what people can pay annually for their medicines. So it's amazing. This is really an amazing thing. But up until now, if you were enrolled in Medicare as a person with a disability or a senior, what you could pay out of pocket for medicine was unlimited. So some people that have really serious health conditions, they may have Alzheimer's, they may have cancer, they might be paying $9, $10, $11, $12,000 out of pocket. And remember, back in the day, we used to call this the donut hole. And it's gotten a little bit better thanks to the Obamacare law, but there's still a lot of people paying a lot of money out of pocket. This law, for the first time, is going to cap the amount that people can pay out of pocket at $2,000 a year. That's it. If your drugs cost more than $2,000 a year, you're not going to have to pay the extra amount. There's a mechanism in Medicare that kicks in for catastrophic coverage. It also caps insulin because there's the growth in insulin users in Medicare is really exponential. It's really incredible. Now, people may know that in the United States writ large, the rates of diabetes are increasing tremendously. Public health experts are really calling this an epidemic of diabetes, right? And so a lot more people are coming into Medicare needing insulin products. And so, and insulin's very unpredictable. There's only one large manufacturer of insulin in the United States. It's Eli Lilly. And for years, they had really a corner on the market, and they raised prices 1,000% over 11 years. It was really incredible. And that's where we started hearing all the horrible stories about people dying because they didn't have access to insulin. But now in Medicare, insulin will be capped at $35 a month. So if you're in Medicare and you take an insulin product, you are not going to have to pay more than $35 a month for your monthly supply of insulin. That is going to help a lot of people. And that's another policy that some lawmakers, including the president, people who watch the State of the Union might have seen this, that the president called for a national insulin cap for people of all ages, $35 for everybody in America, and nobody should be charged more than that for their insulin. There's a couple of other great things in there. There's a provision in the law that basically says drug companies that raise their prices faster than inflation will have to pay a rebate back to Medicare. Now, this might not sound like a big deal, but it's a huge deal because drug companies for decades have been raising their prices faster than inflation. That's why people can't keep up with the price of their prescription drugs, right? Because their prescription drug prices are going up 6, 7, 8, 10% in years when inflation is 2% and people are barely getting a cost of living increase or they're barely getting a Social Security increase. So that provision in the law is really important. It's a price reform that creates a disincentive for drug companies to keep raising their prices, because now when they raise their prices, if inflation is 5% and they're raising their prices 12%, they have to pay that 7% back to Medicare. It gets reinvested back in Medicare. So that's great. And then a couple of other things that the law did was it made all vaccines free. So a lot of vaccines were already free in Medicare, but things like shingles, for instance, you had to pay out of pocket, right? So like at your local Walmart, your shingles vaccine is a couple $100s. That's not a lot to a lot of people, but to seniors on a fixed income like my mom, who's a retired factory worker and doesn't have a pension or anything, $200 is a lot of money. And it
Yes.
might deter people from going to get that prevention because they can't come up with the $200. Or the brand new, there's a brand new, it's not a flu vaccine, but it's a respiratory disease vaccine that's being administered to seniors right now. And it is an expensive vaccine. But now, under this new law, seniors will not be charged for those vaccines. So anything that it might not be like quite routine. It's something extra, but you might be a senior who's immunosuppressed, or you might be a person with a disability and you don't want to take any risks. Those vaccines will be free for you too. And then the final thing is that they're for very low income people that are on Medicare and they need help with out-of-pocket costs when they go to the pharmacy. There is beefed up assistance under the law to help low income people get access to their medicine. So this law does some really good things. It's being implemented. It's not going to be easy to implement it because the prescription drug industry is very powerful and they are challenging it in court. We don't think that their legal challenges are really going to hold up, to be honest. But we also have a Supreme Court that's a very unusual Supreme Court, right? So if this were 5 years ago, I would say, no way. These legal challenges are frivolous and they're not going anywhere. But we have seen under the current Supreme Court with activist judges that they roll back precedent on a lot of things and they are making really unusual decisions that seem contrary to what the legal precedent has been. So we're doing a lot of work to track the legal stuff and also to work with the administration to be back. And the administration is, of course, arguing the cases in court, and already 4 of the lawsuits have been dismissed based on the fact that the corporations did not have standing. So based on the fact that the corporations could not show that they really are being injured by the process of negotiations. The negotiated prices those negotiations are happening right now, and the prices will go into effect starting in 2025. So 1 more year. And I will say, everybody knows this is an election year. A lot will depend on what happens in this election year, right? So if President Trump wins the election, I'm less confident about the law being implemented. And I say that because he is likely to appoint an HHS leader and a secretary of HHS that is from the industry. And people from the industry are not going to implement this law in a very aggressive way because it hurts their bottom line. So let me pause there and see, Sandy, if that makes sense or if there are other things that you would like for me to address. But that's a quick nutshell of what is being implemented right now on prescription drug reform. And as I said, there are a lot of people that are calling for these modest reforms, but really important and historic reforms to be expanded, including people like Congressman Pallone and the president, who are saying, you know what? This could work great in Medicare, but it could work great for people with private insurance. Why don't we expand this? Why don't we have negotiated prices for people with private insurance? Why don't we have $35 insulin cap for everybody? And let's really regulate this industry to make affordable medicines a reality for everybody.
Well, personally, I am blown away and baffled by all of it because, as a person who's either had a private healthcare or through business or through a spouse, I've just always looked at what's my deductible, what's this, what's affordable. And then as I've gotten older and I'm single, it has just blown my mind. And then when I became Medicare this year, I am even more miffed and befuddled, and even gave the documents to a friend to read. And she says, I'm a lawyer. I can't even
No,
understand
I know.
Medicare.
You have to take a week off of a week of vacation time to just even
Yes.
understand what the hell it all means.
And then I had to find an independent agent to try to help me get an Advantage plan that was to my benefit, because basically when you get to be 65, Medicare's like, okay, you've got to take our plan. Right. And if you don't know what plan to take, they just give you one. And it may not be the one that's the most beneficial for what it is that you need. So I found my drug prescriptions to go like this every time I had to go pick something up. And then I said, wow, these are the stories I've been hearing about for decades about how you get to be older and you can't afford your medicines, and how families are trying to pitch in to help their parents. And it's just this vicious cycle. And then in my conversation with you about how insulin was created, and then the market that's not negotiated, how you negotiate everything. How do you not negotiate?
It's crazy, right? I mean, the
blocks?
federal government negotiates the price of aircraft carriers. They negotiate the price of copy paper. They negotiate, I mean, everything, orange cones for construction sites. They negotiate prices with vendors all day long, right? All day long. And then on prescription medicines, in the largest purchaser of the prescription drugs in this country, in Medicare, no negotiations. And where you really see the contrast is when you contrast the cost of prescriptions in Medicare with the cost of prescriptions in the Department of Veterans Affairs, right? So people know, if you know any veterans, many veterans, about half of all veterans, get their health care directly from the Department of Veterans Affairs. Veterans Affairs negotiates drug prices directly with the drug companies. And as a result, they can provide medications to veterans through the VA at a much lower cost, right? $10, all through the mail. It's very low overhead costs. So you look at that, and there's an agency of government called the Government Accountability Office that does these research comparisons. The price of what it costs in Medicare to provide prescription drugs is twice what it is in vets, just because vets negotiates those prices.
Well, I mean, how did we get here? Has it always been like this? But so
Yeah.
many of us have just turned a blind eye and just accepted
Yeah.
it. But
I think it's
we have
hard.
got, well, we,
People don't know, right? It's sort of
yes.
hard. It's hard to figure out what the hell Congress is doing, and it's hard to figure out because some of this stuff is so counterintuitive and literally makes no sense. It's hard to understand like how it got this way to begin with. We are dealing with the aftermath of a system that was really shaped by profit, right? And so here we are in the United States of America where we trust the market, right? And sometimes the market does work for some things, but the market only works if there's competition. And because the patent system has been used to protect drug companies from competition, competition doesn't work to lower prices for prescription drugs. And also competition doesn't work in a lot of healthcare because people do not interact with healthcare in the same way that we interact with other consumer products, right? If you go into a hospital with your relative because your relative is having a heart attack, trust me, you are in no position to negotiate with the physician about whether or not that person's going to have a heart attack. People are not equipped. And even just what you were saying, you got on Medicare and you had to go to a lawyer to figure that is not, other consumer products are not like that. When you go into the store to buy a can of coffee, listen, you don't have to read nine font print for 1,000 pages to figure out what's in your can of coffee, right? For people, I mean, how many people have actually read their insurance plan? I mean, I've been a healthcare advocate for 25 years. I've never read an insurance policy. Couldn't tell you what the hell's in there. And that's the problem. People don't know that there's a problem until they have a problem. Then all of a sudden you're like, oh, I need this medicine that my doctor prescribed. And you go to the pharmacy one day and it's $200. And then you come back the next month and it's $500. And that unpredictability, because the drug companies have monopoly power to raise prices anytime they want, it's really hard on people in Medicare because most people in Medicare are on fixed incomes. They're seniors. A lot of them are not in the workforce anymore, or they're people with disabilities and they have limited income. And that's why they've qualified for Medicare to begin with. So that constant not knowing, not being able to plan, not being able to budget, it's very hard to manage your healthcare that way. You don't know if you're going to have the medicine that you need to stay healthy.
Yeah, it actually gave me a moment of scare. It really truly did. Just having a
Sure.
basic thyroid medication, I'm like, oh dear, I know what can happen if I don't have this. And it would wreak havoc, but it wouldn't be life-threatening in a way that some of these other medications would. But
Sure.
we have got how many baby boomers coming into Medicare in the next 5 years?
Yeah, well, in this country, the aging of the population, it's interesting because it's really not talked about, but it's really the number one public policy and fiscal challenge that we're facing. There are 11,000 people a day who turn 65. 11,000 people a day. There
Wow.
was an article today in Axios about people 100 and over, the growing 400% increase in people living to be 100 and older. Listen, most of us don't plan to live to 100. So as people are living, the fastest growing portion of the population in the United States is people 80 and over. That's the fastest growing portion of the population. And so increasingly, we are going to be facing a lot of challenges that are tied to the cost of healthcare, because it's not just that people are living longer and that there's more aging people, that's now going to be the largest generation of people, but it's also that as people age, the cost of their healthcare is much greater, right? So if we expand healthcare through programs like Medicaid and CHIP for kids, that's an efficient thing to do because most kids, frankly, are pretty cheap to insure. The vast majority of kids, you're talking basic preventative care, and that's relatively inexpensive to provide. When you're talking people 50 over, 65 over, 80 over, now you're talking about people that have lived with chronic disease for a lot of years, and you're talking about degenerative diseases like Parkinson's, Alzheimer's, cancer, which is much more endemic among older people than it is younger people. So we are really facing a crisis because the cost of healthcare for aging people is going to start to take up more and more and more and more of the federal budget. And that's going to cause havoc, right? It's going to wreak havoc. And we're going to have to figure out, how do we pay for the cost of this healthcare? Now, of course, I don't sort of view it as a crisis situation, because we also have gazillions of rich people in the United States that don't pay taxes. So my vote would be, you know what, all these billionaires that right now don't pay any taxes when their assets increase in value, you should tax them. You should tax billionaire assets the way you tax people that work, right? So, and if we did that, we would have a lot more revenue to be able to cover the cost of people's healthcare. But that's all going to be a political decision, and it has a lot to do with who's going to be in office and how much leverage really regular people exert in communicating with their members of Congress and their local state legislators.
So you talked about this law, and you're expecting it to be implemented by 2025, but there's a possibility that it won't pass. Is that correct?
Well, the law has passed.
Okay.
But there's a possibility that it could be rolled back. It could be repealed. And so I'll just say this, and I assume this is a nonpartisan show, but people can go look this up themselves. The Inflation Reduction Act passed with only Democratic votes. That is, there is not one Republican in Congress that voted to support the law. So Democrats passed it with just Democratic votes. Flip to the next Congress. So this law passed in the 117th Congress. We're now in the 118th Congress. Every 2 years is a new Congress. So we're in the second year of the 118th Congress. After the law passed in the 117th Congress, when the new majority took over in the 118th Congress, which is a Republican majority in the House, they right away started to file bills to repeal the law, right? So they can't repeal the law while President Biden's in office, because, of course, to pass a law in the United States, the president has to sign it. There's no way President Biden is going to sign a law repealing prescription drug reform. But now we're in an election year, and next year everything could change. And I don't have much certitude that President Trump wouldn't repeal this law. So if Republicans sweep next year and they control the House and they control the Senate and they control the presidency, I could easily see them repealing the law and rolling back all of these gains. And remember that we've seen this before with other laws, the Affordable Care Act, right? The Affordable Care Act passed in 2010. When President Trump took office in 2017, his number one priority was repealing the Affordable Care Act, and he spent a year trying to repeal the law. Even though the law was popular, even though it protects 150 million people with pre-existing conditions, even though it made preventative care, I mean, it did a lot of things, right? It insured a lot of people. It made people who already had insurance more secure about their insurance, because it stopped companies from doing things like charging women twice as much for a policy as a man, even though it's the same policy. So the president at the time, President Trump, was pretty committed to rolling back that law. He's running for office again. And if you're following what the president is saying, he's already talking about repealing the Affordable Care Act again. Even though it failed in Congress, he would give it another shot. And today he made a couple of comments about replacing the prescription drug reform with a different kind of reform.
Well, I don't think a lot of people understand the Affordable Care Act.
Mm-hmm.
So
you want me to give a quick?
Would you please, so that people can understand it, because people naturally think, oh, Obamacare and this and that, and we're giving insurance policies to all the poor people, and we're going to go broke. So there's all this misnomers out there, or people who assume they understand. If you could maybe briefly explain that.
Sure. Okay, so the Affordable Care Act, which is Obamacare, it's the same thing. Some people call it Obamacare, some people call it the Affordable Care Act. It does two big things. One, at the time that that law was passed, there were 50 million uninsured people. There's a real disadvantage to having 50 million uninsured people. And if you're not, you might think, well, that doesn't have anything to do with me because I'm insured. Think again. Because guess who pays for growing numbers of uninsured people? We pay, right? When people don't have insurance, where do they go? They go to the emergency room. And guess how that emergency room care is paid for? They call it charity care. Guess who's paying for it? We're paying for it, right? We're paying for charity care. We're paying for higher rates of disease. We're paying higher premiums because there's all these uninsured people. So it's the shifting cost. There's a shifted cost when you have large numbers of uninsured people, and that cost gets shifted to the rest of us that have insurance. So it was really a key goal of the law to reduce the number of uninsured people as much as possible. And the law has been effective in doing that. The law has reduced the number of uninsured people to a historic low, down to about 8%. It's about 21 million people right now that are uninsured, and many of those people are uninsured in states like Texas and Florida that have refused to implement the Medicaid expansion provisions of the Affordable Care Act. So one big thing the law did was just expanded coverage, get more people covered. It makes healthcare less expensive for everybody. And then the second thing that the law did, which was really needed, was it created rules for insurance companies. Before the Affordable Care Act, and it doesn't matter whether you get your insurance through the Affordable Care Act or through Medicaid or through your company plan, or you're buying it because you're a small business person, you're buying it on the individual market. Before the Affordable Care Act, there were really no rules for insurance companies. That is, an insurance company could sell you any old policy that maybe didn't cover anything and call it insurance and charge you whatever they wanted for it. That changed. So one of the things that happened leading up to the Affordable Care Act was you had a lot of people who had insurance, but then, like, say you had insurance and you were paying your premiums for 15 years, paying your premiums, just everything's cool, no problems. And then somebody in your family gets cancer. All of a sudden, your insurance policy starts denying your claims. We're not going to pay for this one. We're not going to pay for this one. They start setting caps. Okay, this policy is going to cap out at $1 million, right? They would arbitrarily set an annual cap. Listen, if you have cancer, especially if you have a rare cancer, $1 million is not a lot for an insurance company to be paying out. It could cost well more than that. In fact, we had hundreds of stories of people around the country who had children with leukemia routinely would cap out at $1 million. So what we did with the Affordable Care Act was we established a regulatory framework that essentially made insurance companies follow rules. Another thing that could happen before the Affordable Care Act is if you had a pre-existing condition. So I have ovarian cancer. I'm 50 and I have ovarian cancer. Before the Affordable Care Act, it would have been almost impossible for me to get insurance. No insurance company would have insured me. They would have refused me insurance because I have a pre-existing condition, or they would have charged so much for that coverage that there would be no way that I could afford it. And we saw millions of people priced out of coverage for all kinds of pre-existing conditions. And that wasn't just cancer. That was things like high blood pressure, obesity, diabetes, asthma, and women of childbearing age were considered all to have a pre-existing condition, which is the propensity or the opportunity to get pregnant. So if you were a woman of childbearing age, insurers would routinely charge you more for the same policy that they would sell to a man because you have a pre-existing condition, which is that you're a woman and you might possibly have a child.
Mm.
And then that policy wouldn't even cover birth control, wouldn't cover prenatal care, wouldn't cover pediatric care. So what the Affordable Care Act did was made it illegal to discriminate against people based on pre-existing conditions. So that's a policy we call guaranteed issue. You're guaranteed they're going to issue a policy and they can't charge you more because you have a pre-existing condition, and they can't refuse to insure you because you have a pre-existing condition. Every policy that is sold has to have standard benefits in it. So we call that essential health benefits. And those benefits include things that a lot of people thought were standard in insurance before that were not. Birth control, prenatal care, mental health care, pediatric care, ambulance services, hospital care, all of that, the essential health benefits, the 10 essential health benefits were written into the law so that every policy that's sold on the exchange and policies that providers are providing through group health coverage have to meet that standard. So that was really important. The Affordable Care Act created a medical loss ratio, which means that a certain percentage of every dollar that you pay your insurance company has to be spent on actual health care. Why is that important? Because before the Affordable Care Act, you might have been paying whatever amount, and up to half of what you were paying for your health insurance wasn't actually spent on healthcare. It was spent on either profit, shareholder returns, administration. So here we are paying more and more and more for our healthcare and actually getting less healthcare. Medical loss ratio reduced that so that 90% of every dollar has to be spent on actual healthcare. In some healthcare programs like Medicaid, a public program, it's even more than that, right? Medicaid has the lowest administrative cost of any healthcare program. The Affordable Care Act expanded Medicaid and created an opportunity. The federal government agreed to pay for Medicaid so that a lot more people could get covered through a more efficient program. And then the law did lots of other things, but essentially those are the two categories of things. It created coverage for a lot more people and reduced the number of uninsured people by half. And then it created a whole set of rules that insurance companies now have to follow so that people cannot be denied coverage. Insurance companies can't cap your coverage. They can't stop paying at $1 million. No annual caps, no limits on coverage. They can't charge you more for being a woman or being of childbearing age. So a bunch of things that really should have been basic things that you would think would have been in place already, but they weren't in place. And it was really because of the Affordable Care Act that we put them in place.
So to me, it just sounds like one big racket.
Which part?
All of it. I mean, the Affordable Air prior to the Affordable Care Act.
Yeah.
This has just been, I mean, we always know that insurance can be a ripoff, right?
Yes.
And you never know what your policy is missing until you need something, period. And then that's when you begin to advocate for, I've got to switch policies and get better coverage or find a better deductible or something that works better for your policy for you or your family. All I know is this stuff makes my head spin. And the other question I have, and not trying to get like super political or anything like that, is like, you can have a lot of people that are Republican, right? And they're like, well, the Republicans are fighting because they're supposed to fight for that or fight against that. What would make the Democrats go for this new law and not let there be, I forget the word you used, and the Republicans be against it? So what's the scale there?
I don't know why. Here's what I can tell you. When you get past the politicians and you get actually to people, regular people who vote Republican support prescription drug reform. They do. I mean, most average people support the reform. They want lower drug prices, whether they voted Republican, Democrat. A lot of people that voted for Trump really wanted this law and they really want lower and they want more, right? They want not only affordable drugs for seniors and people with disabilities, they want it for working age people, for kids, young people. So, what happens in Congress is lawmakers get caught up in the politics of their caucus, and sometimes they forget to represent their constituents.
Yes.
That's the truth. And one of the reasons is because they think their constituents will never find out. People in America are pretty unpolitically engaged. And I would say that on some prescription drug issues, there's pretty good bipartisan support, even in Congress, for things like reforming pharmacy benefit managers, which are these, complicated middlemen in the insurance system. So when you get sort of past the political part and you get down to regular people generally support lower drug prices, whether they're Republican or they're Democrat, and they want to see this reform, right? They want to see it hold up. And that's going to be really important because if we get a Republican sweep in Congress, and including some Republicans that really don't care that much about their constituents and are listening to pharma and they're getting huge donations from pharma, we're going to need to go to Republican constituents and say, listen, you need to call your congressman, and tell your congressman that you don't. One of the reasons when Trump tried to repeal the Affordable Care Act, he had a majority in Congress, but even with the majority of Republicans in both chambers, he wasn't able to repeal the law. So there's a reason for that. The reason for that is because Republican constituents called their Republican members of Congress and said, absolutely not. You cannot repeal this. I have a pre-existing condition and I will never get insurance again if you guys repeal this law. So it was really the mobilization of regular people and regular people making their voices heard with their Republican congressmen that stopped the repeal of the Affordable Care Act. And so that's where people just get past the politics and they recognize, oh, wait a minute, this law is in my interest. It's in my self-interest to keep this law because I have a pre-existing condition. And if this law goes down, my insurance company can go back to denying me coverage or refusing to pay my claims because I have an expensive pre-existing condition.
So, we can't bypass the political arena. But we do elect these officials to be our mouthpieces. So
Yes,
really what I'm hearing is all of those who have elected your mouthpiece for Congress, Senate, whatever, you need to be calling them for
absolutely.
whatever reason, not just this particular issue, but for whatever reason, you need to send your emails, you need to make your phone calls, you need to do
Absolutely.
your due diligence
Mhm.
or don't complain about it. Because if you're going to
That's
sit
how
back, yes.
democracy works. Listen, it doesn't work. You know, anybody, if you're a small business owner or you have an employee, if you want to, you can not manage your employee and just assume he's going to the job every day and doing his work, but I wouldn't do that, right?
Right.
Like, and in some ways, that's what's happening in Congress is we're electing these guys. Don't forget, we pay them. We pay them.
Mhm.
We pay them pretty generously. Also, they get lifelong health care. They get retirement. Like members of Congress get a lot of stuff that your average American is not getting, right? Most of us don't have lifetime health care on our job. Most of us don't have a pension on our job. We have to save to be able to retire. So these folks work for us. And whether you're a Republican or a Democrat or an independent or a progressive, whatever label you are comfortable with, you should feel absolutely within your rights to call up your member of Congress and say, what is your position on this? And are you really going to vote to repeal this? Because I don't support that. So I just think that that's really important. And I'll tell you, I've been doing this kind of work for 30 years. There is nothing the lawmakers are more afraid of than hearing from their constituents.
Mhm.
So people should use that leverage. Like democracy is powerful. This is the United States of America, right? Where we can use the political process. We have a democracy. In some countries, people can't even do that. We can do that here. People should do it. And the country is all the much better when we do it. Absolutely. There's no doubt about it.
Yeah, because a lot of people say I'm just one person. Yeah, you're one
Sure.
voice. You're one voice times 10, times 100, times 1,000. Your
Mhm.
calls are getting through, your emails are getting through. What is it that you want to stand for? What do
Mhm.
you want for you, not just for your parents or for you, but for your children and the generations to come.
Sure.
And if
Sure.
we don't start using our own inner power and phone in, we're not going to get the results that we want. And then a lot of people just sit back and all they do is have a bitch fest.
Absolutely. One person makes a big difference. Like a lot of people might not know this, on the day that President Obama, the Affordable Care Act is the biggest healthcare reform we've had in this country since Medicare and Medicaid were created in the 1960s, right? There's no doubt about it. It took years to get to that because lawmakers were so afraid of the insurance industry. When President Obama signed that law, he was surrounded by members of Congress that had helped fight for the law, including now President Biden. But the person that was standing next to him was not an elected official or was not somebody that anybody knew anything about. He was a little kid, right? He was an 11-year-old Black boy that we found in Seattle. And this kid came to a rally because he had lost his mother to cancer, mother 35 years old, didn't have insurance, died of breast cancer. And this kid got active because he really thought, and I think he got active because we were sort of the folks that came along and said, oh my God, that's a really powerful story. You need to tell your story to President Obama. And we brought him to Congress and he testified in Congress. So the truth is, like, one person's voice can make a big difference. So you can
Mhm.
imagine what happens when you tie together voices. We brought a lot of people to Congress who had never testified, never spoken in public, never even testified in church. And they came to Congress to talk about their twin daughters who had leukemia and couldn't get growth hormone because the insurance company wouldn't pay for it, or their husband that was dying of a degenerative disease and they couldn't get treatment because nobody would insure him. So, those thousands of stories, each one of those people, an individual who decided to step up, made up enough power to pass a law that we had not been able to pass for so many years. And that law restructured a fifth of the economy. It was a huge law and it changed the face of healthcare in America and finally brought the United States in line with other comparable countries because it was so bad in the late 2000s that charity organizations were setting up huge compounds in places like Tennessee. Doctors Without Borders was coming here to the United States to provide healthcare to people in the richest country in the world because people could not get access to healthcare because they had pre-existing conditions or because they didn't have it on their job. And you know, and I know there's lots of people who work all the time who don't have healthcare that's affordable on their job.
Well, you know, there's very few people who haven't experienced a doctor writing them a prescription and your insurance won't cover it.
Oh
And then
yeah.
you've got to make your phone calls to go back, pre-authorizations going back and forth to find a drug that's comparable or suitable, or maybe a percentage that you actually
No,
got the drug that they intended for you to have. So we already know the insurance companies are pulling the strings on how we get our health care.
that's right. That's right.
And
And
enough is enough.
physicians are, I mean, if you want to boil down, you know, like what is the problem with American healthcare? It's profit. It's
Yeah.
profit, right? The profit motive creates really crazy incentives for drug companies, medical device manufacturers, insurance companies. And the profit motive has overtaken the actual function of these companies. And we are not going to get decent healthcare that is really accessible for people until we chip away at that profit enough that patients' health actually comes first. That's what we did with the Inflation Reduction Act. It took us 20 years to do that, but we have a lot more work to do as long as this system is a profit-driven system. And you know, my whole thing is I'm not a socialist, so it's not that I don't believe that there shouldn't be any profit. There can be some profit. You know, drug companies can make some
It's
profit.
gotten beyond greedy. It's
But you can't
beyond
kill
greedy.
you can't kill people to make a profit. You can't deny people insulin to make a profit. You can't take away people's health insurance to make a profit. You can't tell cancer patients that you won't treat them because it's not profitable, right? Like at some point you have to draw the line. The United States and Americans spend more money on healthcare than anybody else in the world. Anybody in the world. And our health outcomes are not as good as people in other countries. So listen, I think we have a great healthcare system. It's high quality. The services are there. We have great physicians. It's top notch. The problem is nobody can get that healthcare because people can't afford it, right? That's why listen, it's great that they're inventing all these new drugs for Alzheimer's, but the truth is new drugs cannot help people that can't afford them. So the whole thing is moot unless people can afford the medicine, unless it's accessible to people. Our job really as the consumers of these products as Americans is to push lawmakers to do their damn jobs and make sure that patients have equal footing in the system and that it's not all driven by profit, because any system that is all driven by profit is never going to be a system that works for patients. That's just not, those two things are not compatible.
Mhm. You know, you were telling me a story about how insulin was created and
Mm-hmm.
then what happened with insulin. And I would love if you would just take a moment to share that story. I know you got to go, you got
Yep,
a busy day. We can definitely do a part two because
sure.
this is fascinating information. But if you would share the how insulin was
Well,
created.
yeah, I would love it's a great story. Well, you know, I said at the beginning when I started talking that most medicines are created with publicly financed research. So that is taxpayer funded research. And insulin was discovered in Canada by two doctors, researchers working for the state of Canada at a university. And they were researching treatments for, you know, they understood the mechanism by which diabetes worked, that it was tied to lower production of insulin. And they were trying to figure out, could they treat this with insulin that they extracted from animals? And after having done research, all publicly funded in Canada, they were successful and they were the inventors of insulin. And there's a famous, and people can look this up on Google, there's a famous video of them being interviewed. And an American journalist asked them, this is such an amazing discovery. Because remember, before that, and this was turn of the 19th of the century, like 1901, 1902. Before that point, diabetes was a death sentence to people. Like it was not a very well
Mm-hmm.
understood disease. And the people who have diabetes know that if you have diabetes, it makes you more susceptible to heart attack, more susceptible to lots of other diseases. So these guys were interviewed and they were asked, well, now that you've made this huge discovery, it's really a life-changing discovery. Are you going to patent the medicine? And they were incredulous. They just couldn't even believe that the reporter was asking them this question. Here they had, striven their entire lives to find this cure. And one of them said, well, would you patent sunshine? Would you patent air? Of course, we're not going to patent it. This should be something that's widely available to everybody, and it should be for free, right? The state paid us and invested in this. It should be for everybody for free. And it was for a long time. It was a cheap medicine for a long time until Eli Lilly, huge drug company based here in the United States, figured out how to get a patent on the delivery system for the medicine. So it wasn't even the molecule that they patented, it was the delivery system. And they have been able to extend their patent because, back in the day, if you were taking insulin, not even that long ago, 20, 30 years ago, it would be a shot. But now there's lots of different ways to deliver insulin into your system, right? You can have a diffuser. Every single time that they modify the mechanism, they improve the diffuser or they figure out a different kind of pump to get it into somebody's system, they can extend the patent. And so they were the only domestic producer of insulin for years, and they jacked up the price thousands, just 1,000%, and got it to the point where people in this country could not even afford. You had young people dying because they couldn't get access to insulin. I'll tell you, I could not believe when I started doing research on this, how many Facebook groups exist that are just about people trading insulin back and forth because they can't get access to it. And people have emergencies all the time where they went to the pharmacy to get it. And this month, for whatever reason, it's like 3 times more expensive than usual, and they were not able to get it. And then they get on the Facebook and somebody helps them and brings insulin to their house. But this is the United States of America. Like, you should not have to depend on the charity of your neighbors to get something as basic as insulin.
It's insane. I don't know. I could talk for hours about this, but I know that right now, anyone that's going to be listening is going to be mind blowing. Like, I'm going to have to listen to the replay so that I can understand all the things that you've been saying. So, Miss Executive Director of Healthcare for America, Margarida George, I want to really thank you for taking the time today to be with us and enlighten us and educate us on a really critical topic. And it's beyond acute right now, and we need to get on the phone and we need to call our congressman. And what exactly would we be saying in our emails or our phone calls?
I think 2 things. One, if you're calling a congressman who voted for this, who voted for the Inflation Reduction Act, usually a Democrat, every Democrat in office has voted for it. The first thing to do is thank him. Thanks for passing that law. That's a really good first step. And then the second thing is, we should expand it. You know what? Everybody in America, no matter where they live or how much money they have or what age they are, should be able to get access to affordable medicine. You guys should expand this. Like, somebody should file a bill and you should expand the provisions in the Inflation Reduction Act to cover everybody. So if you're talking to a Dem, say that. If you're talking to a Republican, you should say, I'm disappointed that you didn't vote for the Inflation Reduction Act because it lowers drug prices for everybody in America. But can I count on you to refuse any repeal bill that comes across your desk? Right? So for Republicans, you want to ask them to commit against repealing the law, because that repeal is coming. If they have, you want to get them on the record, right? And really like pin them down. So if a repeal bill comes up in Congress, are you going to vote for that or are you going to oppose that?
Okay, so these are calls and emails that would go to our congressman.
Absolutely, because this is a federal bill, so it'll go to your
Yes.
congressman.
Okay. All right. I just want to understand that.
Yep.
All right. Well, I really appreciate your time. Anything else you want to close with?
Nope, that's all I have. I appreciate the opportunity to come on, and I'm glad to come on anytime and talk through any of these issues.
Oh, I really appreciate it. We're definitely going to be doing a part 2, but stay put and say goodbye to everybody.
Bye, everybody. Great to have the opportunity to talk with you, and I hope you all contact your lawmakers and tell them that you want to see more of these kinds of reforms that make medicine accessible to people.
Awesome. Thank you so much. All right. Bye, everybody. Please remember to like, subscribe, and share, and leave your comments for this video. Thank you. Bye-bye.